Hi, my name is Dr. Scott Hernandez from Kai Fitness. This is a tip I was going to go over with you guys today in reference to the hip. I had a question tonight after class about how to foam roll out the outside of your hip when you have that tightness in the outside, when you cross your leg over and it's really tight. You know, most of my clientele between 40 and 65 will go through a knee or an ankle or a hip problem, usually lower extremity, when they first start training because of the imbalances in their body above and below the area. You know, so if you have a weak core, you know, that can usually present with some hip issues and some upper back issues. If you have a weak ankle, that usually relates to knee issues. So I'm going to show you guys first video how to roll out the outside of your hip. Now, what's rolling out to? Well, self-myofascial release, which is what they call this. Basically, all it does is compress and push out some of the toxins in the tissue, because a lot of the pain and the tautness comes from a thing called ischemia, which is a lack of oxygen getting to the tissue, and the nerves and the arteries that run through that tissue are being occluded. Therefore, no blood flow goes through the tissue gets tight, and it affects the whole area, and this can affect up and down the chain of muscles. So to roll out the first muscle on the outside of the hip, the gluteus medius is this muscle on the outside. It goes up into the sacrum from the outside of the hip. That's at the top of the glute. So what I'm going to do is I'm going to place the foam roller. Now I'm getting up on this bench so I can show you. You can do this on a yoga mat. And I'm going to be on an oblique angle. So now I'm not sitting right on the butt cheek. The sciatic nerve runs down the leg behind there. You don't want to be right on that, especially if it's tingling. So I'm going to roll down and up. Now I'm positioning my upper body so that I'm not uncomfortable. So that might be a good position there. My neck is straight, my spine is straight, and I'm going to roll up and down that tissue. Now I'm going to roll out about a span of maybe 4 inches, 5 inches up and down where those tight areas are, around the back side of the hip. We don't want to be on the hip itself like that, just in case you have some bursitis in there, that'll just make it worse. So you roll up and down. Now I have a tight area in my glute there from an old injury, so I'm feeling a knot there, so I'll just milk that for about a minute, minute and a half, okay? I'll usually go below and above that issue as well. So the outside of the hamstring, the lateral hamstring, I roll up and down the top part of that, just like so. My leg is straight. I'm just putting some pressure in that area. Again, the upper body, you might position yourself maybe with the elbow on a couch. It just depends on what you have around you. Due to demonstration, this is all I got, so we're doing this. So you roll up and roll down for the same amount of time. Last thing you can do for the top of the hip here is stay on that QL, quadratus lumborum is the muscle from the top of the hip up to the bottom of the ribs, right there, and then also the erector spinae, which is right beside the spine. So we're going to do this facing straight up, and we're going to go bone by bone. First the bottom bone, then the second one up, and I'm going to do maybe about a 3-inch up and down movement. Okay, if you have a lot of arthritis in your back, you know, don't over force it. We're just getting some circulation through there, some mobilization. So I'm going to roll up and down, flexion, extension. You might get a pop toward the top where the curve goes up into your mid back. So what I'll do in that position, well, I might get a release and I'll just extend a little bit farther and pop, pop, pop. There you go. There's the pops. Now the pop is no big deal. That's just like gas being released in your knuckle. So those gases give you a little bit of a feel-good response. So that is how you roll out the whole quarter of the side here. Now the stretch you want to do after you roll out and get some circulation to that tissue is a figure 4 stretch. We just take the leg over like that. I'm on a step up. And so what I'm doing now is I'm going to stick my chest forward and go ahead and get the outside of the hip. There's no need to push this leg out like that. That's not a very good idea, especially if you have instability in the hip. So I'm just going to stick my butt out and lift my back. So let me show you from this angle real quick. So like that, and then I'll arch my back and I'll get that hip to stretch. 80 degrees is considered normal in this area here. People with tight hip capsules, it might look more like that. So just stretch till you're comfortable. You can pull over the leg a little farther and then pull that knee up and then forward, and you get a little bit more stretch into that. Now, contraindication would be something like spondylolisthesis or a spondylolysis. That's the lower back joint, the L5, L4 area, have a lack of union, and so it can move freely. You don't want to get on a foam roller and shove that bone forward and back. So if you have one of those, talk to your physician, your chiropractor, your DO, whoever treats you for that condition, and maybe ask their opinion on that. As far as knowing more about what to do for those tight areas, I would go neuromuscular therapy, works on the trigger points in those areas, and they're really good about finding those points and releasing them. Massage therapy, if you were to go to a regular LMT and do some effleurage or some deep tissue work, you're going to work the whole link of muscles up and down. So it's not the same thing as a self-myofascial release. This is temporary, just to get some tissue flow. It does not replace soft tissue therapists or modalities that you can use that would work much better for that. Chiropractic analyzes the ankle, the knee, and the hip and how it relates to the back. So if you feel like there's some misalignment issues, if it keeps coming back again and again, get a proper orthopedic or a chiropractic examination. Or if you have a physical therapist you like, they can all examine you and give you an idea of what's happening. So if you like this video, go ahead and click like. And if you want to know more information, go ahead and add that under the comments section and I'll reach out to you individually. Have a happy and a healthy day. From Kai Fitness, stay strong.